Welcome to Shine Tech's YouTube channel. In this video, I'm going to go through true or false multiple questions. So anatomy, true or false multiple questions. So question one here. So in these questions, we have a statement which you have put in bold here. So this statement must relate to the choices which have been given here and determine whether these statements here are true or false relating to the stem or the statement in bold there. So the first statement or question one states the phrenic nerve. So the phrenic nerve A strives to reach midline or at all levels, and B medial relations identical, C only supplies one side of diaphragm, and D arises from C6, E both give off recurrent laryngeal nerve. So let's start with A to see whether it is true or false in relation to the phrenic nerve. So A says this nerve, which is the phrenic nerve, it strives to reach the midline of at all levels. So is this statement true or false? So let's see the phrenic nerve and determine whether it strives when it passes from the superior part to the diaphragm. So in this diagram here, this is simply the retro view of the thorax cavity. So the phrenic nerve is simply this nerve which is here. This nerve here is the phrenic nerve. So this is the left phrenic nerve, and we have the right phrenic nerve. So as it passes from superior to the diaphragm here, it doesn't pass through any organ, but it passes freely from that side to this side, meaning it does not strive, meaning this statement is false. So we go to B. Medial relations are identical. So this statement is relating to the left and right phrenic nerve. So in relation to left and right phrenic nerve, they are saying their medial relations are identical. So let's see. So this is the left phrenic nerve, which is the left retro view of the thorax cavity, where we find the left phrenic nerve, which is this nerve here. So when you see, look at this diagram here, you see that the phrenic nerve is related to the arteries, which this is the descending aorta, and then we also have this common carotid artery there, which are going up, and then so meaning the left phrenic nerve is related to the left arteries. It is related to the arteries. Now let's look at the right. So the right, simply the right side, the right retro view of the thorax wall. So this is the phrenic nerve there. So the phrenic nerve is in the right, at the right side, is related to the veins. We have the inferior vena cava here. We also have the internal thoracic vein, which is that vein there. So meaning the right is related to the veins and the left is related to the arteries, meaning they are not medially identical. The relations are unidentical. So meaning statement B is also false relating to the phrenic nerve. So let's go to statement C. So the phrenic nerve, they're saying only supplies one side of diaphragm. So when you look at these diagrams, this is the left phrenic nerve. Now it separates the left portion, it's innervate, or it supplies the left portion of the diaphragm, and then the right supplies the right side of the diaphragm. So this statement is true. Only supplies one side of diaphragm. So this statement is true. So this statement is true. So D, let's look at D. They are saying the phrenic nerve arises from the C6. This is false because the phrenic nerve arises from C3. It arises from C3 and C4 and C5, mainly C4. So the statement D is false. Then E, both give off a recurrent laryngeal nerve. They give off recurrent laryngeal nerve. This is false as well, because the vagus nerve is the one which gives off the laryngeal nerve. So statement E is false. Okay, so that is all on question 1. So question 1, A is false, B is also false, C is true, D is false, and E is false, relating to the phrenic nerve. So let's move on to question 2. Question 2 reads, which of the following statements concerning a typical intercostal nerve is incorrect? So here, all these statements should relate to the typical intercostal nerve. So statement A is saying it is mixed spinal nerve. It is a mixed spinal nerve. And B, it passes in the neurovascular plane between the internal intercostal and innermost intercostal muscles. And C is collateral. Its collateral branch has no calcaneus distribution. And D, in its course around the body wall, the nerve lie between the vein and artery. Okay, so the last statement is saying the main nerve itself has an anterior terminal branch. So let's start with statement A. It is a mixed spinal nerve. This is true. Why? Because the typical intercostal nerve, it is a mixed spinal nerve. It arises from several roots, and it has motor and as well as the other nerves. So it is simply a mixed spinal nerve. That statement is very true. And B, it passes in the neurovascular plane between the internal intercostal and innermost intercostal muscles. So its passage, where it passes, let's see where it passes. So this is the intercostal nerve we're talking about, this nerve which is passing there. So when you look at that nerve, we have muscles here. We have the innermost intercostal muscle, which is inside, the muscle which is inside there. Then from there, we have the internal. So the second muscle is the internal intercostal muscle, and we also have the external intercostal muscle, which is the last muscle here. Now, where this typical intercostal nerve passes, it passes in between the innermost and the internal intercostal muscle. So in between the two, in this region there, that's where it passes. So let's look at this view. So this diagram here shows the same nerve, which is that nerve which is arising there. So it enters into these muscles here, which are the innermost intercostal muscle and the internal intercostal muscle, which is in between. Now the space which is created there, that's where the typical nerve, the typical intercostal nerve passes, and even the blood vessels there, that's where they pass. So let's go back to our statement. So our statement was saying it passes in the neurovascular plane between the internal intercostal and innermost intercostal muscle. So this is true. We have seen in the diagram that it passes in the internal and in the neurovascular plane between the internal and the innermost. That's where the typical intercostal nerve passes. Okay, so the state as B is true. So let's go to C. Its collateral branch has no calcaneus distribution. So C is false. Its collateral branch has calcaneus distribution. It also innervates the surface or the skin. Okay, so let's see this collateral branch. So the collateral branch are simply the branch as it passes like this. The branch that branches from the same typical nerve, that branch is called the collateral nerve. Collateral nerve. So they are saying this collateral nerve branch has no calcaneus. So it has a calcaneus distribution which goes to the peritoneum and even the lower part of the body. So this statement is false. It has a calcaneus distribution. Then D, in its course around the body wall, the nerve lie below the vein and the artery. So question D, statement D is true. As we have seen in this diagram, the nerve lies below. It follows that sequence there. We have the vein followed by the artery and then the nerve below. So the statement D is true. It lies below the vein and the artery. So the most superior is the vein followed by the artery, then the typical intercostal nerve. So this statement is true. So E, let's go for statement E. The main nerve itself has an anterior terminal branch. So the main nerve has an anterior terminal branch. So this is true. So when you look at the main nerve here, it has a terminal calcaneus branch. That is the main nerve coming from there. When it reaches the sternum here, it has a branch, a calcaneus branch, which is the anterior calcaneus branch, the anterior terminal branch at the sternum. So that statement is true. So that's all for question 2. Let's move on to question 3. So for question 2, A is true, B is true, C is false, and D is true, E is true. Question 3 reads the chest wall. So all these statements should relate to the chest wall. The chest wall. So A, the neurovascular bundle lies between the external and internal intercostal. So this is false because we already saw in the diagram the neurovascular bundle lies between the internal intercostal and the innermost, not the external, but the innermost intercostal muscles. So this statement is false. The transversus muscle lies between the internal and the external intercostal. So this transversus muscle is simply the muscle which is in front here. Just beneath the sternum, we have the transversus thoracic muscle. Okay, so that muscle does not lie in between the internal and the innermost. So this statement is false. This statement B is also false. Why? Because the transversus muscle do not lie into in internal and external, but it is below the sternum, below the ribs. Then from there, let's go to statement C. So statement C is saying the intercostal artery lies between the nerve and the vein. So we already saw in the diagram that what starts is the superior, we have the vein and followed by the artery, then inferior we have the vein, the nerve. So we have the nerve there. So what is in between is the artery. As we can see in this diagram here, we have the vein on top followed by the artery and the nerve below. So this statement here which is statement C. The intercostal artery lies between the nerve and the vein, which is true. Let's go for statement D. The intercostal artery is more superficial than the vein. That is false. We have already seen in the statement C. The intercostal artery is not more superficial than the vein. So question 3D is false. Okay, and then question E. So question E, they are saying runs it runs a vein, nerve, vein, and artery. This is false because it runs in this way. We have the nerve followed by the artery in between, and now after the artery we have the vein on the superior. So this is also false because this is not the sequence in which those three runs. Then let's go to question statement F. So statement F is saying B, meaning this statement is relating to B there. It is relating to B. So B runs above rib. So we go to statement B, the transversus muscle. They are saying it runs above rib. So that this is false as well because the transversus muscle doesn't run above the rib, but it runs below the rib. And then G, they are saying C runs under inferior border. So G is true because C, that is the intercostal artery. It runs under inferior border. That is, it runs in the inferior border of the ribs. That's where the intercostal artery runs. So this is true. So for question 3, the correct answer is A is false, B is false, C is true, D is false, E is false, and F is false. Only G is true. So let's go to question 4. So question 4, regarding the right coronary artery. So regarding the right coronary artery, A, it goes through the left auricle and the infundibulum. So this statement here is false because the one which goes through the left auricle and the infundibulum is the left coronary artery, not the right. So in this diagram here, this is the right coronary artery. So this is simply the anterior view of the heart, and then we have the left coronary artery there. So the left coronary artery runs in between the auricle and the infundibulum, which is simply the calcaneus arteriosus on top here. So this is the left coronary artery. So the left coronary artery is the one which courses through the left auricle and the infundibulum, not the right coronary artery, making this statement to be false. Then B supplies 60% of the AV node. So let's see the AV node. So the AV node is posteriorly. So this is the AV node there. So when you look at the AV node, what is the branch? The branch of the AV node is the atrioventricular nodal branch of the right coronary artery. So the right coronary artery is the one which supplies about 80% to the AV node, not 60%. So it is 80%, not 60%, making that statement to be false. Then C usually has a posterior interventricular branch. They are saying the right coronary artery, it is usually has a posterior interventricular branch. So this statement is very true because it has a posterior. So this is the anterior, now this is the posterior. So when you look at this posterior, you can see the right coronary artery. The right coronary artery is this one here. So posteriorly it has this branch here, this branch which is going like that. That is from the right coronary artery there. So that branch, this branch here, it is coming from the coronary artery and it is posterior. It is at the posterior part of the heart. So this statement C is true because the right coronary artery has a posterior ventricular branch. So let's see the interventricular branch. This is the branch here. It has a posterior interventricular branch, which is that branch which is going in between the ventricles of the left ventricle and the right ventricle here. So in between them there is a branch of a right coronary artery there. Okay, so that statement is true. Statement C is true. So supplies 30% of SA node. So this one is false. Statement number D in relation to the right coronary artery is false because the right coronary artery supplies 60% of the SA node, not 30, but it is 60% of the SA node. Then this is false. And then E, 50% of AV nodes are supplied by the right coronary artery. This is false because 80% is about 80%, not 50%. So 50% is wrong. So that is false. Then F, 50% of SA node is not 50, but it is 60. So this one as well is 60 of SA node are supplied by the right coronary artery. So this statement as well is false. It was supposed to be 60 there, not 50. So G arises from the posterior sinus. So the right coronary artery, if you can see in this diagram here, this is the anterior view. So this is the right side. So it arises from the right sinus, not the posterior sinus. So making this statement to be false. So for question 4, A is false, B is false, and C is true, D is false, E is false, F is false, and G is also false. So we move on to question 5. So question 5 reads, coronary arteries. A, the right arises from the posterior coronary sinus. We have already seen in the previous question, it arises from the right, not the posterior. So making that statement to be false. So that one is false. There are arteriolar anastomosis between the termination of the left and right coronary arteries. This is true. There is an anastomosis. This is very true. So when you see this diagram here, there is anastomosis there. This is the left and this is the right. Where they meet there, they form anastomosis. So it is true. So C, the left supplies the conducting system in the majority of patients. This is false. This is false. The one which supplies the conducting system in the majority of patients is the right, not the left. Then D, right arises from the posterior coronary sinus. The right arises from the right aortic sinus, not the posterior, but it arises from the right. Okay, not posteriorly. So E, left supplies, so this one is false. Left supplies the conducting system in most of patients. So question 5, E is false. The one which supplies is right, not left. Then we move on to statement number F. Right supplies the posterior descending branch in most patients. So the coronary arteries, so the right coronary artery, they are saying it supplies the posterior descending branch in most patients. So this statement is very true. The right coronary artery supplies the posterior descending branch in most patients. That is very true, because when you see in this diagram here, this is the posterior view, this is the anterior view. So this right coronary artery, it goes posterior that side behind there. So let's see the posterior view, it comes this side. This is the right coronary artery, so it is also supplies the posterior side, which is supplies the posterior descending branch in most patients. Okay, so this is true. And then G, there are no arteriolar anastomoses between left and right. So their anastomosis Moses is there. So this is false. They are supposed to be yes, they are there. So that is for question 5. So question 5, we have false, true, false, true, false. Those are the correct answers. We have false, true, false, 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 true, false. So thank you very much for watching. Don't forget to like if you like my video, and subscribe and hit that notification bell so that you don't miss any of my videos, and leave your comment in the comment section below.